Last week, Britain's second biggest provider of private healthcare reported a surge of 81% in self-funded patients. That is, people paying for their own care on a one-off basis rather than having it paid for by an insurance scheme. Now, as well as those figures from that healthcare provider, Spire, the NHS's own figures reveal that the number of patients being seen face-to-face by GPs is down by 23%. compared with pre-COVID times. I actually thought it was worse than that. Now, to talk about this, I'm joined by Dr. Bob Gill, who is a GP based in South East London, also the producer of the crowd-funded documentary, The Great NHS Heist. Well, thanks for your time, Bob. It's pretty alarming that so many people are taking the step of actually paying to see a GP now, isn't it?
Yeah, it's a worrying reflection of the immense pressure that general practice is under, not only because of the effect of the pandemic, the backlog of work created by the pandemic, but also the decline in number of GPs as a proportion of the population. The numbers of GPs has actually diminished in the last couple of years. So we have fewer GPs seeing more patients who have increasing demands.
Now, is this a problem that's specific to this country? Because we do have far fewer physicians per head of population than the rest of Europe, certainly, most of the first world, and that predated COVID. So has COVID actually made things worse everywhere or just here?
Well, I think it's been a particular problem in this country, partly contributed to by how the pandemic was handled. So if you remember back to the early part of 2020, GPs were effectively taken out of the pandemic response and patients were asked to go straight to 111. GPs were instructed by NHS England to effectively close their doors and go to a virtual service. And I think part of the problem we're seeing now is a knock-on effect of those decisions, which, to my mind, were poor. I'm one of the few GPs who never closed my doors. I continued to see patients face-to-face throughout the pandemic, but we took mitigation. We made sure that the waiting room was never crowded. We spaced out the clinics. So, and I refused on principle to go to a virtual model of telehealth because I knew that there would be a knock-on effect in terms of patient access and satisfaction, and also you lose the opportunity to examine the patient. So I thought there was inherent risk with that move, and I ignored what the government and NHS England were telling us to do.
And what the government has been saying is that actually, teleconsultations are very, very popular with the public because they can get them when they want and they don't have to, schlep all the way down to the doctor's office, and it's a winner. But you're saying that that's not the case.
Well, we have to balance convenience with good medicine. And a fundamental part of practicing good medicine is to examine the patient. And if you're reducing the service to a telemedicine, lack of continuity of care, and removing the examination aspect of your assessment, then that builds in more risk and more danger for the patient in the long term.
It looks very much as though this is the sort of thing that would happen if a government were keen to run down a system to actually force people to just give up on it and go private.
Well, it's something, you mentioned my film in the introduction, it's something we predicted back in 2019 before the pandemic struck. The NHS is on a path to privatisation. The current health and care bill before Parliament will be the final nail in the coffin, I'm afraid. And politicians need scapegoats. And I believe the GPs have unwittingly fallen into a trap. And all the defects in the system, the build-up of demand, the lack of capacity, far easier to blame the GPs than 10 years of underfunding and defunding that the government have been responsible for.
Now, other countries in Europe, they do have what to us looks like a private medical system, but they don't seem to spend more per head of population than we do, and their outcomes are better than ours. So is that the direction of travel, do you think, that this country is going in? Or are we perhaps going to a more American system where you get excellent health care if you've got a lot of money, and if you don't have a lot of money, you get nothing?
Well, the destination is certainly the American system. Many of the NHS leaders have had experience in the American system. The legislation replicates the American system. If we compare the original Beveridge model of the NHS, it was beautifully efficient. It had a 3 to 4% running cost. But, the privatisation train has been going a long time. So we're 20, 30 years down the process of privatisation, and that has vastly increased the cost of the market bureaucracy, the cost of the increasing bloated management structure within the NHS. So governments have made the current NHS far less efficient than it used to be in preparation for privatisation. So we're a long way down this road, and we're not following the European Bismarck model, which is employer-based insurance and state coverage for everybody else. We're following the American version. Even in the European version, they have a parallel bureaucracy. They're not only collecting money for paying for healthcare through taxation, they're collecting money through an insurance system as well. So that duplicates bureaucracy. And there's no economic argument for following that system either.
Well, the government would say this is absolutely not true. We have no intention of privatising the NHS. It's safe in our hands. Nothing could be further from the truth. And we're investing ever larger amounts and, hiring, I can't remember what number they came up with in nurses. Is it 20,000 or 50,000, something like that? But they're pouring no end of money into the NHS. So it's actually down to the physicians to actually make it work. So it does sound as though they are putting the sort of nexus of blame on people such as yourself.
Yeah, and they always default to the money argument. But just as I've laid out earlier, a lot of this money is not going in the provision of healthcare. It's going to pay for private finance initiative debt. It's going to pay for market bureaucracy. And it's paying for the demolition of existing services. So the money isn't the problem. It's where the money is going. The legislation in front of Parliament as we speak is about creating and breaking up the NHS into 42 what are called integrated care systems, which will replicate the American managed care system, where they'll be working to fixed budgets from which they can make a profit through the denial of care. Now, this will be a disastrous development for the general public.
Is that opinion common among the medical profession, or are you an outlier in that regard?
It's common amongst the people who have been following and studying the privatisation over the years, yes, but it's not well understood amongst the medical profession partly because our union, the British Medical Association, has kept them in the dark, has gone along with a lot of the privatisation. So that is a big problem.
So if you were in charge of the NHS, what would be your top priority?
I would stop any further cuts and closures of NHS hospitals. I would introduce a significant pay increase for the staff, not only to make up for what they've lost over the decade of austerity, but to stop them leaving. We need to keep hold of experienced staff and value them and stabilise the system. And then I'd introduce legislation to renationalise the NHS and remove the tumour of privatisation, which is sucking the lifeblood out of our beloved system.
It is odd, though. I mean, some people might say that, an enormously unwieldy organisation like the NHS, which is state-run, is absolutely prepped for a place where money just disappears, rather than something that is run along private lines, which would be much leaner and more efficient. And if you go to a restaurant, you'd rather go to a restaurant that's run by a private company rather than the government, for instance.
Yeah, so we've had a very recent example of this mythical private sector efficiency with the test and trace system, run by Serco and Deloitte, which has so far squandered £22 billion without having an impact on the progress of the pandemic. Now, how efficient was that? That was a total waste of money down the drain. In terms of healthcare, when patients are sick, they're not in a position to be weighing up which doctor provides the best service. And it comes down to trust. If the patient is reliant on trust in their relationship with the doctor, but there's money involved, well, there's a financial interest which is potentially toxifying that relationship. So if you go to see a surgeon, you need an operation. How do you know he's offering the operation you need and not a bigger operation from which he can earn more money? That's the problem with the American system. It's inherently fraudulent. There are perverse incentives, and the trust between patients and healthcare professionals is very much lower than it is in this country.
Do you think you can see an end to the difficulty that people are getting booking an appointment with their GP, or is the situation that we have now where people are being fobbed off with telephone consultations, is that our new future, the new norm?
I'm hoping more GPs realise that they've been lured into a trap. They need to restore face-to-face consultations wherever possible, try and maximise continuity of care, because that does bring along with it efficiency, and restore that very precious doctor-patient relation, which is being tarnished at the moment, quite deliberately, I think, with the right-wing press, and it certainly suits the agenda of the government, which does want to trash the reputation so that people are softened up for a gradual drift to the American system that is planned.
All right, thanks, Bob. That's Dr. Bob Gill, a GP based in South East London, also the producer of the crowd-funded documentary, The Great NHS Heist. So, if that is actually what's happening, that we're charging down the route to an American system of health in this country, then this land has lost its mind. I mean, of any medical system in the world to replicate, the American one is absolutely the last that anybody should be contemplating.